Good evening, everyone. My name is Jasmine Smith, and this is a PSA announcement. This PSA announcement slash video is based on Turner's disease. Turner's disease is a woman's disease based on a woman's ovaries. Turner's disease is a disease that can cause women to be infertile. Turner's disease is where a baby girl may be missing part of one X chromosome because there is a deficiency in the amount of genetic material. Turner's disease is a chromosomal problem that affects 1 in every 2,000 females all over the world. Turner disease, also known as Turner syndrome, is a rare disease that only affects females. However, have certain signs such as women being unable to conceive a child because of the absence of the ovarian function. Other features of this condition that can cause vary among women to have Turner syndrome include extra skin around the neck, puffiness or swellingness in the hands or feet. Girls who have Turner's disease, or also known as Turner syndrome, are shorter than average. They often have normal height for the first 3 years, but then have a slow growth rate. At puberty, they do not have the usual growth spurt as other girls all over the world. Non-functioning ovaries are another symptom of Turner syndrome. Normally, a girl's ovaries begin to produce sex hormones as estrogen. This does not happen in most girls who have Turner syndrome. They do not start their periods or develop breasts without hormone treatment at the age of puberty. Even though many women who have Turner's disease have non-functioning ovaries and are infertile, their vagina and womb are totally normal. In early childhood, girls who have Turner syndrome may have frequent middle ear infections. Recurrent infections can lead to hearing loss in some cases. Girls with Turner syndromes are usually of normal intelligence with good verbal skills and reading skills. Some girls, however, have problems with math, memory skills, and fine finger movements. While symptoms of the Turner disease, also known as Turner syndrome, may be apparent at birth, the conditions often isn't officially diagnosed until puberty. One of the main reasons for delayed diagnosis is the fact that early symptoms such as short stature are often dismissed and not contribute to delayed growth. Similarities of sexual relationships. This sexual underdevelopment associated with Turner syndromes cannot be identified until puberty. Turner syndrome is a rare disease that can affect a female both physically and emotionally. About 2,000 girls has had Turner disease in each and every ethnic race. Humans have 23 pairs of chromosomes that contain the genetic information that determines our physical and mental and at times emotional characteristics. In fact, each human cell contains a single pair of X and Y chromosomes. Women, on the other hand, normally have 2 X chromosomes. This disease can be very stressful for someone that is affected with the disease. It can affect them in ways you can't imagine. Though things may be perfect on the outside, there are things going on inside. This is a very important and serious disease that can carry on throughout thousands of women every day. There is multiple tests that you can have done for this disease. Any woman throughout any ethnic race can have this disorders. So be sure to always check on your health. Adios, my friends, and until then.